Hey everybody, I'm Marlon with Chronic Pain Warriors United. I hope y'all are all doing well and have had a great weekend. All you mothers out there, happy Mother's Day, especially those of you living with chronic illness or pain. Y'all are some of the bravest, toughest people I could possibly imagine, and you're definitely not acknowledged enough for it. So thank you. Real quick, before you leave today, please hit the like button. It helps dispense the video out to the YouTube guides. And if you haven't subscribed yet, please do so. Every voice in the pain management reform movement is important. Y'all are all important. And to all of you new subscribers and all of you contributing and commenting, thank you very much. Y'all are amazing. I really appreciate it. So this Sunday, we're talking about the war on pain patients and the fentanyl crisis, along with pain management reform. And a lot of people wonder how they're linked, but they're kind of so tightly linked that it's hard to talk about one without talking about the other. And I thought maybe talking about a little timeline of events and might be the best way to explain it. So let's hop in the Wayback Machine and go back to 2010, let's say. Excuse me. The news media is telling us about pill mill systems popping up all over the place. The DEA is shutting down a new pill mill and arresting doctors every day, it seems like, in South Florida, Alabama, West Virginia, Oklahoma, or California. It's like all over the place. And they are hyping this and pushing this constantly every day for years, it seems like, from 2010, 2011, 2012, and on forward. It's been basically the main public health issue. So what was the DEA doing at the time? In 2010, the DEA was already active and trying to stop the diversion of prescription pain medications and stop the opioid crisis. Now, real quick, what is diversion? Diversion is when a doctor prescribes medications to a patient. That patient takes those medications and then illegally sells them onto the black market. Excuse me. Now, the DEA's actions all through 2010 to, let's say, 2016, that's the line of demarcation where things change. But from 2010 to 2016, they are going after the doctors in the pill mills. They're doing perp walks, and they're doing this on purpose. It's called chilling the room, and it's sending a message to all the other doctors out there saying, this could happen to you. And as a call effect of that, doctors started policing themselves, as it were. They were cutting back on prescriptions for pain medications drastically by the time the DEA and CDC decided to fully invade our healthcare in 2016. So doctors were already cutting back, and the DEA was running massive operations like Operation Oxy Alley and Operation Snake Oil were two big ones. Now, in the whole history of the DEA, they have only ever accomplished a stated goal once. They have never, ever stopped the flow of drugs in any way other than stopping the diversion of pharmaceutical-grade pain medications onto the black market. By the time 2016 rolls around, there are very, very, very few prescription pain medications available on the black market. It has gone pretty much exclusively fentanyl and heroin by that point. And a consequence of that, that became a consequence of the DEA shutting off and stopping diversion. There's no more known or safe, if you want to call them that. They really were safe and known in a lot of ways. There's no more known pills on the market for real, and you're starting to roll the dice with fentanyl and heroin. That's really what it was starting to get into. And then in 2016, that's where things changed. They did the Comprehensive Addiction and Recovery Act, and the DEA pretty much, along with the CDC, fully invaded our healthcare. The CDC released the 2016 opioid prescription guidelines, one of the most damaging medical documents of all time that was not really based in science, medicine, or fact. It was just all emotion in response to the opioid crisis. And then the DEA and states came behind them and made those guidelines into DEA regulation and or state law with the force of law behind them. And that's when they basically took control of the pain management system. They told our primary care providers, you're no longer going to be able to treat your patient's pain. And countless pain patients were stripped away from whatever doctor was treating their pain and herded towards the pain clinic system, right? Excuse me. They were herded towards the pain clinic system. Now, for whatever reason, countless numbers of those pain patients were not ever able to get back into the pain management system. And now they're faced with a choice. Do I suffer or do I try to go to the black market and self-medicate? I self-medicated for years. My co-founder also did so. Back before we were launching, he was cut off from his pain management doctor for no reason. And then he went on to the black market to self-medicate because he had a type of pain you can't just ignore. And he wound up getting into legal trouble. And after all that, he just took his life right before we launched. And countless stories like that have played out all over the country since the DEA invaded our healthcare. As they succeeded in stopping pill diversion and stopping pharmaceutical grade pills from getting onto the black market, you still had this massive number of people who were already using the black market at the time to get pills. They just stopped getting pills and are now getting heroin or fentanyl, and it's killing them in massive numbers. On top of that large group of people who are already using it, there's a new influx of huge numbers of chronic pain patients who are being forced to self-medicate. That's why the opioid overdose deaths in 2010, when a lot of this was peaking, the pill mills and the opioid crisis, there were 21,000 opioid-related overdose deaths in 2010. By the time we get to 2023, it is up to 81,000. That's because there are no safe opiates left on the black market, and there are massively more people using it than ever were before 2016. That's the real line of demarcation. And everything just got worse and worse. The more the DEA tightened the screws, the more people died. Even actions like telling the pharmaceutical industry to cut prescription pain medication production 10 years in a row, to the point now where there's constant traditional pain medication shortages that are even affecting hospice patients, palliative care patients, and cancer patients. People that the DEA and CDC swore these things would never impact in the first place. Everything they did made the situation worse than if they had never done anything at all. If the DEA and CDC had never acted, there would be fewer people dead today than there are now because of their actions, no doubt. And not a small number either. It's large. So that's how the pain management system and the fentanyl crisis and the war on pain patients are linked, because everything the DEA has done to stop the opioid epidemic, to stop pill diversion, made the situation worse, to the point now, I don't know you ever put the genie back in the bottle. The numbers are declining slightly, but I think that's just because it's so dangerous to now try and use the black market. Some people are just saying, I'm not willing to roll the dice anymore. But there are a lot of people out here who do not seem to understand that there are pain patients that really don't have a choice. Excuse me. There is pain that cannot be ignored, no matter what some people want to think. And those people are being forced to make choices they should never have to make. And this is where pain management reform comes in. We should have control of our health care and our pain relief from start to finish, point A to point B. A doctor, cops, pharmacists, or politicians should not be in charge or control of our healthcare and our pain relief. That is far too personal of an issue, and it should be ours to control. End of story. But it's not. They have taken pretty much complete control of the pain medication system, the pain management system, and made it all but impossible for a lot of people to access effective pain management. And that is a big reason why you are seeing these numbers the way they are. And it's heartbreaking and wrong. And that's why pain management reform is so important. People's lives are being lost for no reason, both their quality of life and their actual lives themselves. And there is no scientific, medical, or logical point to it, and we've got to stop it. And that's what we're here for. We are going to stop this. Whew. I'm Marlon with Chronic Pain Warriors United. I hope you all have a great rest of the night. Happy Mother's Day to you all again. I really appreciate you all. Cheers. Be well. We'll see you this week and Monday. Cheers.